This thing, this flesh right here, what is it? What's it called? And how do I make it go away? If you're wondering about this little fleshy shadow and mound on the side of your mouth, stay tuned as I will explore the anatomy, appearance, and treatment of the so-called perioral mound. Hi everybody, I'm Dr. Jonathan Zelken, a board-certified plastic surgeon in Newport Beach, California, here today to discuss the so-called perioral mound. The perioral mound is this indistinct phenomenon that occurs outside the corners of your mouth. The corners of your mouth are called the modioli, and outside of that, you have this convergence of muscles and mucosa and skin and fat that give rise to a shadow and a bulge in some patients that will conspire to form a marionette line or melolabial fold that makes you look less happy, more tired, older, etc., etc., etc. The perioral mound is vexing in this specialty because it's not easy to treat, like buccal fat pad excess, for example. It's also age and weight indiscriminate, like buccal fat pad excess, meaning that even if you're super skinny, you might still have this big bulge right here that can't seem to go away. And that makes your face look older, more sunken in, and it's a real problem. So how do I fix the perioral mound? Before I answer this, I want to review the quick anatomy and the features of the corners of your mouth. This drawing will depict the corners of the mouth of a handsome young man who has this phenomenon called the perioral mound. You'll see that there are multiple components contributing to it. The first thing that you notice is that there will be a muscular convergence. Down coming from your cheekbone are your zygomaticus muscles. Then you've got your orbicularis oris muscles, which circle the mouth like a sphincter. You've got muscles called the buccinator on the inside of your mouth that come towards the sides of your mouth and help you pucker. Then you've got fat above it, and you've got skin above it. So there is truly a skin, fat, and muscle component to the buccal fat pad, as well as thickened mucosa, which is the pink stuff on the inside of your mouth. Those four major players can be manipulated to make this appearance less noticeable, and I treat different patients differently based on what is contributing to this the most. So in this patient, you'll see that she has a fatty excess. This is a very attractive young woman who doesn't have much facial fat, but she does have a perioral mound that is attributable to fat excess at the corners of her mouth. So this is excised using face tight, and during the face tight process, I am using micro liposuction to get the fat out, and I'm using radio frequency energy to tighten the skin over. This before and after clearly shows the benefits of doing this alone in a patient with a fatty component to her perioral mound. In this next patient, you'll see that this is a handsome young man who is very thin as well, and this gentleman doesn't have much fat. He just has skin and muscle excess over the perioral mound, and some of this can be contributed by the fact that he's got a little bit of a retrusive chin and a little bit of a weak jawline, and there may be a compensatory nature in the musculature around his mouth. In this patient, I performed a procedure called buccinator-mucosal myectomy, meaning the buccal mucosa and the buccinator muscle are very carefully trimmed in an area specifically underlying the excess of mucosa and muscle in this region. These are two strategies for two different patients to treat a vexing issue that is not a big deal unless it bothers you in patients indiscriminate of age, race, gender, and BMI. I hope this helps. If you have perioral mounds and you want to have them treated, I'm happy to discuss it further with you. If you haven't already, please subscribe to my channel and feel free to leave comments below asking questions about what you would like me to discuss next.